Hello, this is my second video reviewing the study done by Dr. John Leddy in regarding to post-concussion disorders. So we took this information, this treadmill test and the exercise protocol that he devised from treating acute concussion patients and said, I wonder if we can use this in treating those patients that are post-concussive disorder. Now currently the definition of post-concussion syndrome is any symptoms that last longer than 21 days, but they rarely last up to a year. And as we know, that is definitely not true because there are some of us that are suffering 2, 3, 8 years past injury and still having these symptoms. So he also did the treadmill test with patients who are complaining of post-concussive disorder. And what he found is that if exercise intolerance is the number one indicator of a head injury. So meaning the treadmill test is actually about 15 minutes long. If you could exercise to exhaustion, means you were not post-concussive. If symptoms limited you from completing the test, that means you were post-concussive. So any symptoms could be headache, dizziness, brain fog, nausea, any start in symptoms or any increase in symptoms, and that you had to stop the test, put you in the category of post-concussive disorder. And of the patients that he studied about 20% were what he called physiological post-concussive disorder. So what were the other percentages? So 55% were actually cervicogenic or vestibular patients. So that means that the symptoms that they're having is actually coming from their neck or from their vestibular system and not necessarily from the head injury itself. So that you might be able to go to see a vestibular therapist, and that might help you out very well, or a regular PT that could help with working on your neck or craniosacral, that sort of thing. So that was 55%. 5% is actually caused by migraines. Another 5% was mood. They were severely depressed. And the remaining 15% he actually called the healthy warriors. So these are people that are actually, their head injury has resolved, but they have been unable to move past it because they've been worried about whether or not they were healthy. So if you could complete the concussion treadmill test, then you fell into one of those categories. If you could not complete it because of symptoms, you were in that 20% physiological post-concussive disorder. So what he did was he treated them the same way that he treated the acute concussion patients by giving them an exercise protocol based on your heart rate. So you would exercise to a point based on your certain level of heart rate, and you'd exercise until you could get, just let me refer to my notes real quick. He deemed recovery as being able to exercise at 85% of your age-predicted maximal heart rate for 20 minutes without symptoms for several days in a row. And if you're able to do that, he deemed you as recovered. Unfortunately, what I talked about before in the first video about functional MRIs, they are not as clear with the differences between post-concussion disorder and regular healthy subjects, so that's not exactly a great way to determine whether or not the patient has been healed with a post-concussion. And then secondly, the neuropsych testing also didn't really clearly indicate whether or not a patient was post-concussive or had recovery from post-concussive disorder. So hopefully this information could bring a little light to your situation, and I would hope that you would be able to follow up with a physical therapist, bring them the information from this study, ask them if they can access the Buffalo Concussion Treadmill Test and the exercise protocol, and hopefully maybe you'll have some decrease in your symptoms and be on your journey a little bit better. Thank you.